What would you do if you are outside with your loved ones having a nice day and then all of a sudden an accident happens and the front tooth breaks, or even worse, you lose it? It's gone, it's on the ground. What would you do back then? Welcome to this exciting episode of the Wonder Tooth podcast. And before I continue, please make sure you like, comment, and share, and make sure you follow our channel so that you can learn more in the future, and share it with your loved ones as well. And for this particular episode, there is a code Dent 62, DENT 62, to get a complimentary consultation, a virtual consultation in our office, and you can check the link in the bio. Let's go back and talk about trauma. What would happen if you fall, or you hit your tooth, or you get into a fight, or something happens and then your front tooth is chipped, fractured, or even worse, you lose it. It's gone. It's out of the socket and it's gone. Some people would be like, what? I've never heard of that before. Well, actually, it does happen. And the treatment consideration for each particular trauma is completely different than the other one. First of all, let me introduce myself. My name is Dr. Radwa Saad. I am a practicing dentist in New Jersey, and I am the owner of Blanche Dental, one of the most luxurious dental offices in the US. And I've been practicing dentistry for over 20 years now. I just have a nice look, I guess. I'm licensed to practice in New Jersey, and as well as in Canada, and as well as in Egypt. So I've done it all. I've been doing dentistry for the longest time, and I love it. I have a lot of knowledge that I want to share with you guys. So please make sure, if you like the episode, that you follow and you like and you share it with your friends also, to spread the knowledge. So I'm going to talk today about front teeth. What happens if you, let's say you're eating, you bit on something hard, your front tooth, part of it chips. Or get into a fight, something happens, somebody knocks your face, and then basically you have a fractured tooth. Or even worse, you are biking and you fell like head first, and then your front tooth is out. What would you do? This is a very important question, and I personally have seen this a lot in my office, and thank goodness I was able to help a lot of patients with this particular thing. So the treatment is really different from one thing to the other. And I actually had a patient last week. He was playing volleyball with his friends, and one of his friends kind of hit him with the elbow on his face, like right here. And he came to me and he said, my tooth feels like it's off, and what do I do? And that particular scenario made me say, you know what, let me do an episode, a podcast particular about this, because this is an important thing. A lot of people, they don't know what to do. They will put it in ice. They will put, like, especially if the tooth is out of the mouth, they will put it in ice, or they will just, okay, let's forget about it. Let's go to the dentist and try to get another tooth or something. And I'm talking about the natural tooth. I'm not talking about a filling or a crown, or I'm talking about a natural tooth. So what would you do? First thing, do not panic. Especially if you're a parent, do not panic, because if the kid sees the parent panicking, it's gonna become hysterical. So first thing, calm down, because this is very important now. I know it's heartbreaking to see your kid, bleeding and the tooth is broken or something, especially if it's a permanent tooth. So how can I find out if it's a permanent tooth from a baby tooth? Well, permanent teeth, they start to erupt around age 6. And they look completely different than baby teeth. They look bigger, they look wider, sometimes are shorter depending on when they erupted. And a lot of them, they have mamelons with basically like the little striation on the biting surface of the tooth. I'm talking about the front teeth now. This is just to start to identify baby tooth from a permanent tooth. After that comes, let's say it's a piece of the tooth that's chipped. So depending on how old the person is, if it's a younger person, there is a big probability that the nerve might have been involved. And why is that? Because when the tooth is like, fresh, new, coming into the mouth, the nerve is actually pretty big. It's large because it helps, to give nutrients and nerve to the tooth. And basically it's big. And then once the tooth is completely formed, and I'm talking about the bottom part or the biting surface, the crown part starts to form first, then the root starts to follow. And usually the tooth, it takes the root around 3 years to completely form. So if the front tooth, starts to erupt at age 6, the root will be completely formed by age 9. Does that make sense? Now, with age and function, and we are chewing and we're biting and we are functioning with the tooth, the nerve starts to get actually a little smaller. And why is that? Because there are nerve cells inside that basically the odontoblasts, I'm becoming a little technical, they start to actually build more on the inside, so the nerve starts to become thinner. And why this is happening? Because the tooth is trying to protect itself. You're eating, you're functioning. If you get a cavity, if the nerve is still very big, then it's gonna get into the root canal like right away. We're gonna be talking a root canal right away. But with time and age and function, it starts to get thinner, okay, like the nerve. And that's why in the older population, sometimes the nerve might completely close and becomes like what we call a calcified root. Like we can't really get into to do a root canal. It's completely closed. It's like a piece of marble. Now let's go back and talk about, it's a nice scenario. It's a nice outside and the kids are playing and the kids start falls or, hit something and part of the tooth chips, like a small part. So first of all, we have to see if there is bleeding, if the lips are bleeding, anything is bleeding. This is number one. Number two, if there is sensitivity. So sometimes if the chip is very superficial, like in the outer layer of the tooth, which is the enamel thickness is usually between 2 to 2.5 millimeter thick. And I'm talking about the biting surface. So if that part is chipped, there are no nerve endings in the enamel. So sometimes it might not be too sensitive. You hit it with the fork, a tiny piece chips. It's still, if it's sensitive, that's another scenario. If it's not, you can just go to the dentist and they can just smooth it out. If it's something very small, or if you bite something a little hard, like, I don't know, like an olive pit or something tiny, and it kind of like a sliver of the tooth, breaks, very tiny, we can just smooth it out. You don't really need to have something more than that. But let's say you bite something and now the inside surface of like the inner layer of the tooth becomes exposed, which is the dentin. So the outer layer is the enamel, the inside layer is the dentin, and inside of that is the nerve. So the middle layer, which is the dentin, this is where the nerve endings are. And if the chip basically gets to that point, then a filling has to be placed, depending how big it is. If it's a small chip, then a small filling can do. You just have to be careful of front tooth. So you just have to learn not to bite on it, bite on the side, or cut your food in small pieces. Pizza crust, stuff like that, you're gonna have to learn how to bite on the side. But you just have to be careful. Now, let's say if it's something a little bit bigger, like a fracture, like basically 1/3 or 1/2 of the tooth is gone. So this is when you really have to get that evaluated right away. If the chip is, of course, in the dentin, and if it's a little too big, like 1/3 of one, like not 1/3 to 1/2 of the tooth, you might need to get a crown. Not necessarily a root canal, but a crown. So that's why you need to go to see the dentist to evaluate that. Because if it's a big crack, a filling will not do. So a lot of patients, can you just put a filling? If I put a filling now, by the time you leave the door, it's gonna break. You bite something, it's gonna crack, and then you're gonna continue to come to me and be like, why it's failing? Because it needs to be fixed right from the first time. And a lot of patients, they don't want to take responsibility and no, I didn't say that. Well, you need to have a crown done. You need to have something more permanent done. So are we good on this? So if it's a tiny chip in the enamel, it can sometimes be just kind of smoothed out. You're good to go. If it's a little bigger, then you need to have something much more permanent, like a filling, or even more than that, like a crown. Now, let's say the crack is big and the nerve now is exposed. And some people, they don't really feel that exposure like right away because it's like a shock. The adrenaline is pumping and you cannot really feel the pain yet. You go to the dentist, they have to take a little x-ray and then they can tell you what's going on. If the nerve is involved, then you definitely need to get a root canal done, even if it's not hurting you, because if you wait a little bit longer, that nerve is going to disintegrate, is going to basically start to die slowly. Then all of a sudden, you're going to come with a swollen part on the lip inside, or even worse, like an abscess. And we don't really like any abscesses in the head and neck because this is, the brain is right here. We don't want any issues. So If the nerve is exposed, then a root canal has to be done, and then a crown has to be placed as well. Now, let's say the hit happened so hard, the tooth is not broken, but the tooth feels off. And this is what happened with that patient who came to me last week. The tooth is nice, like there is nothing, like it's not cracked, there is no crazed line in it, it's not broken, but it feels off. Which means one of three scenarios now happened. One, if the tooth gets intruded, it means that it gets pushed more into the socket. So the tooth or the root is held in the bone by like something called a socket, which is like, you know, a little concavity, and the root fits in. Now, it's not attached completely. There is a tiny little cushion, which is the periodontal ligament. So the periodontal ligament is our friend. That's why we don't want to have any gum disease or periodontal disease at all, because we want to preserve that beautiful periodontal ligament. Remember, the periodontal ligament is our friend. So the ligament is basically what's attaching that root into the bone inside. Now, if that tooth gets pushed more in, so we call it intrusion, it gets pushed in. So what you need to do at this point, you need to go to your dentist, because they need to kind of pull it out slightly, and then we have to splint it. Okay, you cannot do that at home by yourself, because you might it's too much. So very gently, we kind of put it back in the proper position. Then we splint it from the back, from the inside of the teeth to the adjacent teeth to make sure it's properly placed in position. Then we give you like a round of antibiotics. Then you have to take something for the inflammation. Remember, Tylenol is not for the inflammation. Tylenol is a good painkiller, but it's not an anti-inflammatory. Advil or Motrin or any of those, on the other hand, they are anti-inflammatory and they will help. Then you have to be on a soft diet for at least a week or two. Okay, so this is in case of an intrusion, like it got pushed like a little too hard in. Now, what about extrusion? Like basically the tooth got moved, but it's slightly now, it feels longer. Like basically you're biting and it's like it feels longer. This tooth, you have to go to your dentist, and I wouldn't even go to the emergency room. You have to go to your dentist right away, because then they have to push it back in place, and the same thing, they have to splint it, and they have to monitor that, and they have to give you the antibiotic and the anti-inflammatory, and you have to be on a soft diet. And I mean soft diet, like you cannot bite on that tooth now for like at least a couple of weeks, because we want the periodontal ligament to regenerate. So what happened is a trauma inside. Now let's say something happened, an accident happened, you fell, and now your whole bite feels off. You're biting down and the bite feels off. This is very, very important now. You really have to go to get a scan done. Like we have to check to make sure there is no broken jaw bones, or even worse, like something in the TMJ here, because sometimes if you get a trauma like this, it gets actually into the joint here. So you might get some fracture here without even noticing. So anything like this, you need to get an x-ray done. So whether you go to the emergency room if your dentist is closed, or you have to go to your dentist right away. So remember, if it's like this, or even worse, if you have like the lip or the inside, you have laceration, like a cut or something, you have to go get that checked right away, between emergency room if your dentist is not available, or to go to see your dentist, or even an oral surgeon or a maxillofacial surgeon. Your dentist would know exactly where to refer you at this point. Now, let's say you're playing and you fell, and all of a sudden your tooth is out. The tooth is out. And that happened actually in my office like a few years ago. This is not very common to happen. So I am in my office doing, what I do every day, like, blah, 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 filling, crown. And then all of a sudden I see my assistant coming running, and we have an emergency. And I said, what's going on? And I just numbed the patient, because I'm going to start a dental procedure. Like it was a small procedure. And then all of a sudden I see the dad coming with the bag, a zip lock with ice and 2 teeth in it, 2 teeth. And the kid is following with like a big chunk of cotton in the mouth. And he was biking with his friend going down the hill, and he had a helmet, which is really crazy, guys. He had a helmet, but he fell front, like face down on the ground, and there was a rock, and thank goodness it was at least the teeth. Nothing else happened to the face. He fell on his mouth. Imagine if it was something else. So I said, okay, well, this is what we call a true emergency. And I went and I apologized to my other patient who I just now, because right now I have to I have to take care of this immediately, because now we have a time frame that we need to reinsert those teeth back in. And this is where the very important part of this episode is actually going to start. Now, let's say that tooth is out. What do? So the kid actually, he didn't realize that his teeth were on the ground. One of the people passing by, she was like, oh, you have to take your teeth with you. So he took the teeth and he didn't know what to do. So he went home running and they washed the teeth and then they put them in ice. Thinking, biopsy, whatever, you put them in ice. No. What you need to do immediately at this point, two things. One, you can kind of clean it. You don't touch from the root part. You touch from the biting surface part, from the crown part. And you try to put it back in the socket. If you cannot do that, the best thing to do is actually put it inside your cheek. Leave it in there, because the saliva, because the ligament, remember our friend, the periodontal ligament? So there are cells in there. If you put it in salt water like saline, or you put it in ice, the periodontal ligament actually starts to die. It gets destroyed and it dies. And they're very important. We need to do this within the first half an hour to hour. After 2 hours, there is a very high chance that this is not gonna take. Like the body is gonna be like, I'm not doing this. What is this? It's not my own. It's something else. So very important. If a tooth like it's completely avulsed, it's outside, it's knocked out. What you need to do, you clean it, you put it back. If you can put it back, even if you put it reverse, I don't care. If you I need to go back and put it in the socket, because we need the blood supply. We need the blood. We need this to kind of reattach back to periodontal ligament. Even if you come and I have to remove it and put it the other way, it's fine. It's fine. So number one, you clean it quickly, even if you don't touch it from the periodontal ligament. You just touch it from the top part. I know some people will be like, what is she talking about? But this is really it. You can maybe rinse it super quickly, like 1 second, just like this, and you just put it back in. Or you put it, if you cannot put it back, or you're like, oh my God, mom, I'm like, I cannot do this. Tell the kid to don't put it in your mouth, put it in the kid's mouth. You put it in the cheek, inside the cheek. Let's say they don't know how to do this. You can put it in milk, cold milk, not in water though. Put it in milk, okay? It's a little bit, it has more pH closer to the mouth, okay? So this is number one. Number two, you run to the dentist office and they're gonna do this. So first thing, of course, we have to numb the area. And we have to check, if there is any laceration in the lips, what's going on, any fracture in the jaw, because this is very important now, especially if it's a kid. So you don't want to miss that, because otherwise the jaw might grow, like different, because, if you miss a crack and then the jaw is still like growing, it might grow like off. You really have to check that. Then okay, the tooth we actually take the tooth and we put it back inside. And I usually kind of flush it when you put it back in, then you splint. How do we splint it? So we go from the back of the teeth, not from the outside. Actually, in that kid's case, I think I splinted from both outside and inside, because I had 2 teeth that were completely out, and the third tooth was actually avulsed, like it was almost out. So I pushed those 2 back into place, and then the third one I adjusted it, and then I put it's a very thin tape, and you go from one side all the way to the other, from outside and from inside, and you secure them with like a composite filling, like a white filling, so the teeth are basically now in place, locked. Then I put the kid on antibiotic and painkiller, anti-inflammatory, and a soft diet. Then the kid has to come back in 2 weeks to kind of check what's going on. Now, usually remember when we said after between 30 to 60 minutes, the teeth can go back in, and you might not need to do a root canal, because if it's done like quickly, like the reattachment, basically the blood supply is still there, bleeding, it's a favorable condition, you put it back and splint, and sometimes the periodontal ligament can reattach and we're good to go. If it's been outside the mouth for that long, then as I said, the periodontal ligaments start to die, the nerve tissues and the blood supply inside the tooth start to die. And at this point, we have to do a root canal. So the kid came back to me, and of course, you know, the nerve is dead. So I had to go back from the inside, do the root canal. Actually, we did it in 2 teeth because the third one was just a valve, so it was fine. So we did the root canal in those 2 teeth. That was 5-6 years ago now. The kid just came back recently. They're still in. Teeth are still in. We're still good. Even though he came to me in like around the 2 hours scenario. I think it was around the 2 hour scenario. But the bigger mistake was that they put it in cold water. So remember, it has to go whether in the socket or you put it inside the cheek. Don't swallow it, obviously. You put it inside the cheek, or worse, you put it in milk. Cold milk, not cold milk from the fridge. Don't put it in water. Don't put it in ice. And I guess this is it. But the very important thing, you have to, especially with kids playing, you always have to have a sports guard. Not a night guard is for the nighttime, and it's basically like the thin plastic thing that you wear, and it covers like part of your tooth. A sports guard is like the bigger thing, you know, the boxers, they use that. So I would really recommend all the parents, if you have a kid who's playing sports, please let them wear that sports guard. Like if that kid was, I don't know, he was wearing the helmet and everything, but just we have to be extra careful, you know. Sports guard, you can buy it from any store. You put it in a little bit of warm water and it just kind of protect your teeth, okay? Or your kids' teeth. So if you're playing any sports, I don't know, like boxing, even basketball, a lot of times, you know, they get, you know, hit, or the ball hits them in the face. Just wear something to protect your teeth. I hope this was informational, and I really want you guys to tell your friends about this, because a lot of people, they don't know when something like that, you don't think it's gonna happen to you until it really happens to you or your loved ones. So just kind of share the knowledge, share it with your friends. And of course, don't forget to follow and share and subscribe. And don't forget, if you take care of your teeth, they will take care of you. Until then, keep smiling with Dr. Saad with full teeth. Have a good one, everybody.